So I'm going to do a tour of the GP room. This is one of the GP room in out of hours. So we have the bed here. You can see there's a trolley with some bed rolls and extra universal wipes. This is the light if we need to examine internal examination or skin examination. Some gloves in all sizes. The sink where we wash our hands is a touchless, so you can just use your knee and you can open and stop the water. Some alcohol gel, some soap, guidance on when you need to use your gel, glove or hand washing, and some instruction on how to wash your hands. Urine dip there, a normal bin, a yellow bin for the clinical waste, 2 chairs, one for the patient and one for the relative. And this is machine that we use to check the observation. We have the normal pulse oximeter. We also have the baby one, so this will be for newborns. We can use to check for their sats. This is sharp spin, some tissues, this is a lock cabinet. I'm not sure what's in there. Some envelopes if we need to refer patient to the hospital, some papers, ophthalmoscope and otoscope which is stuck in the wall. It works really well. I like this one because they are very bright. Oh, not sure why they're not working, but it was working. Oh look, it's working. It's really good and it's plugged in, so you can be very sure that the light is bright. I think they have some flow chart to manage UTI, which is one of the commonest presentation to come here. Here's some notice board, some of the pharmacies which is open on Saturday and Sunday pharmacy rota, so we can direct patients. This is the printer, so there's some for blood tests, but we don't normally do blood tests in and out of hours. And then some prescription papers at the last. And let's have a look. The drawers, there's some stethoscope if you forgot to bring some of the earpiece, tongue depressor, urine pregnancy test, measuring tape if you need to measuring skin lesions, stool pot, urine pot, thermometer, ear probe, and some syringe as well. Let's see what's in here. More, there's some big flow, mouthpiece, stickers for pediatric patients, speculum, need to do internal examination, and some of the otoscope. I think this is more sanitizer and just a bit of alcohol swabs. Vienna, warming bowl, and some aero chamber. Melon chart as well, aero chamber but with a mouthpiece. So there's a mouthpiece here instead of the mask. This is the table that we sit, chair, headphone that we use to speak to patients, some thermometer. And this table, you can make it a standing table. I'll show you. So you can be healthy, and instead of sitting down, you can use the table standing. There's a clock at the door. Extra plugs. This is for like emergency call button, so if you have collapse or you're in danger, then you can press this, somebody will get back to you. We have all these cupboards that they are all locked. Some more people up there, not sure what paper this is, and that's it. That's the clinic room. We store our medication. Obviously there's a curtain as well, so we can close the curtain, preserve our patient's dignity so that they can be behind the curtain to get undressed or get dressed. So if you don't know what BNF is, this one is 2019-2020, so it's kind of not up to date. Is the UK what we use to medication guidelines. It's really useful. Like for example, you have the medication name, what's the indication, the dose, contraindication, and the caution. It tells all the information, and you can read it in your spare time. I know pharmacists do read it in their spare time. They like to read their BNF. I like the part where there's a palliative section, but how usually is you search for the medication name at the index at the back, and then you look at the number, page number, and you open the page. For example, this is Sarazad 806, so you go to page 806 and then you find the medication. Let's see, 806. Here it is. see there's levonorgestrel. This is the medication, the forms, the brand name, how much it costs. But nowadays I tend to use the BNF app because you can just search in the search button rather than using the book. So nobody uses the book anymore, but I know some people do, especially if you don't have reception. And it's updated every year, so there would be a 2023 version. But this is what we use in the UK for the medication BNF, and it's got 78, 79. So walking outside, you can see there's a few rooms and there's an apron, few more gloves and also face masks. And walking through the corridor, there's another trolley. Now this trolley has a PPE for COVID, and this is some supply for the GP out of hours. And this is our kitchen, so there's microwave, there's hot water, and there's tea and coffee inside with some mugs, some cutlery. This is thing that we use to make medication for children medication, hot water, microwave. So there's another emergency button here as well. So you can call for if we leave the patient, for example, here while waiting for ambulance, and we can give this call button and they can press the bell whenever needed. If we found the patient collapsed, we can also pull this button as well. I've used once this emergency button when I had a patient who had cardiac arrest, and everybody just came straight away. So it's 5 a.m. 3 more hours for my night shift to finish. There's no patient at the moment. Just having a quick break. I'm actually not well myself, so that there's a mirror as well so that we can check ourselves, make sure that we're presentable before seeing patient.